Hi everyone, I'm Saleha and this is Chai Chat and Community. Fertility is one of those topics many of us whisper about, especially in the South Asian communities. When couples struggle to conceive, the blame often quietly falls on women. But the truth is, it is more complex and more shared than we realize. Today on our podcast, I'm joined by Associate Professor Darren Katz, Melbourne-based urologist and leading expert in male fertility. We are talking about men's fertility, breaking taboos, and how families can move forward together without blame and without shame. Darren, thank you so much for joining me.
No, thank you so much for having me on. I really do appreciate it. This is such an important topic for so many people.
It is, it is. So before I spray you with questions, and you know I have many of them, so can you please briefly tell us about yourself and why male fertility became such an important part of your work?
I'm a urologist and a male fertility specialist based in Melbourne, Australia. And for many years, I've worked with couples who are been really struggling to conceive, and it became very clear to me from the very beginning of my journey in managing patients with fertility that the male was often sidelined, often invisible, and that's despite the fact that in half the time of in a couple's infertility, there's a male factor at play here. So I've spent much of my career trying to change that perception, and through clinical care and surgery, research, teaching, and I've more recently developed the first ever Australian guidelines on male infertility. My goal is to bring sort of the male infertility idea into the mainstream of medicine, lessen the taboo, the stigma, and really let people understand it's a very common problem, and often there are treatments that can be used and helped a couple overcome, this terrible issue of infertility.
Thank you. So, in many multicultural cultures, infertility is seen as a women's issue, like we know, and like the story I just told you earlier. Why does this belief still persist, even though medically, as you said, we know that fertility challenges affect both men and women? Is it equally? And, uh,
I mean, it actually is equally. So in 50% of the time, there's a male factor at play. 30 and in 30% of the time, it's actually only a male factor. And if you look at all of the reasons why a couple goes through IVF, about 30% of the time, there's only the male factor at play. So then either it's going to be a pure female factor in about a third of the time, a pure male factor in about a third of the time. And in the other third of the time, there's, the male is, it's called, mildly subfertile. The woman is mildly subfertile, but together as a couple, they're infertile. So it's really common. About half the time there is a male factor at play. But it makes sense that traditionally, and even currently, a lot of the time, unfortunately, women are seen as the ones who are blamed for the infertility when certainly it's not. Well, sometimes it's not. At least half the time it's not, because they're the ones that show physical signs. Those are the ones that carry the baby. And in a male, you can be perfectly healthy. You can look like, a strong, strapping male with no outside signs of disease, but yet you can be completely infertile. Not one sperm can be coming out, and no one would know unless you tested. So, and that's the reason, unfortunately, traditionally, even still now, even though I've been trying to change this in Australia, this whole perception and how things are managed, still now, when a couple is infertile, the next step is for that person to go and see a doctor to be assessed, the female that is. And again, the male's often just put to the side until she's done her testing, and then they'll say, could be months, could be who knows how long down the track. Oh, we might as well test your partner, and then, oh, wow, goodness, wow, there's a problem here. So it's really important, and this is one of the key guideline statements. One of the first guideline statements, recommendations that we made in these Australian first ever guidelines was that a male and a female need to be tested simultaneously when a couple presents for infertility. Very important. It could also, not only can it speed up the time of diagnosis, but it can also avoid the female going through, unnecessary tests. Very important.
Thank you. So when couples come to you, Darren, how often do you see a woman shouldering the blame?
Look, it's interesting. Women have the outside, they often have the emotions that have come to the surface, whereas a male, I find, keeps it inside.
Yeah,
When a male is diagnosed with infertility, it's a real hit to a man's masculinity. It can be a real, they really suffer. And I've published on this, the psychological effects of male infertility. And so, although outwardly the women may be the ones who would call it emotionally expressing that, the men are suffering inside as well, and then that shouldn't be ignored. And I often tell a man as they're going through this infertility journey to say, look, this is tough. This is not going to be easy. This is going to be a journey, a roller coaster, ups and downs. And it's important that you get help, even if you have a strong relationship, seeking some professional assistance, counseling. I tell them it's a sign of strength, not weakness, to do that. And sometimes just that permission that a man gets is something that they're looking for from a specialist or from anyone to say, look, I'm actually doing it tough, and to have that permission to go and seek help is critical.
thank you. And again, this is what I think you've kind of answered my question about the shame that men get from being tested. So what worries men more and when they come for their first appointment to you?
So, like I said, when men come to see me, and and often they come often they come by themselves, and at
Oh,
first,
okay.
yeah, yeah, it's surprising. Like they'll say, "Well, look, it's my problem." And they've often been diagnosed prior to this, and I say, "Look, this is not your problem. In fact, this is a health issue, and
Yeah,
it's a couples thing we need to deal with here, right?" And what I say is that next time, bring in your partner. It's really important because this is not about blaming. This is not about whose fault. It is about how, as a couple, we are going to make sure that, well, in the best chance that we've got is to make, you be the biological father and you be the biological mother. That's the goal here, and we need both partners on board in this. And because this is a sort of a stressful time for the partner, for both partners, especially the male, as I mentioned to you, it's a real hit to their masculinity, stress. It's stress. They can become depressed. Uh, you know, they often say that, I get home and, my partner just, hounded me with all these questions, and I couldn't remember, what we said. And that's so important for them to come in. As often if a male comes in without their partner, I'll say, if possible, can we even get your partner to call in and just listen into the conversation? Just because she might have her own perspective on things, or volunteer other information as well. So if there's one message that I can give to the couples out here, is that this is a couples issue. You've got to deal with this together. And this is not about blame, just like it's any other medical issue. This is, fertility is a medical issue. But it's the good thing about it. Often there's often solutions to problems.
thank you. So in simple terms, how common we've talked about how common it is. It is 30% male, 30% women, and the other half, I think it's whatever. So what are some everyday factors that can affect male fertility? Things that men may not realize. Is it like stress? Is it drugs, alcohol, like I asked you
Yeah,
earlier?
look,
Yeah.
I think all of the above. Sometimes there can be, a major fertility issue. Call it, like people have got they've had testicles that didn't quite develop as well, and they had to have operations on them. Cancers when they were younger, some genetic issues. There are things where you can have your major problems with fertility. There can be, what we call patients who have got mild infertility, and that can often be things that perhaps it's part of the environment, smoking, stress, excess alcohol. But there's one point I think is critical that we need to sort of, let's call it the elephant in the room, and I see this not infrequently, unfortunately, is testosterone abuse. So unfortunately, with the advent, especially of social media and men in the gym, they're getting these testosterone steroids, and they're using these sometimes for years. And these are often guys that look very strong and
Yeah.
muscly, very masculine, but a lot of them are completely infertile. And why is that? It's because the testicles do two things. They make sperm and they make testosterone. And when you give the body excess testosterone, or basically almost any testosterone, then the whole testicle shuts down, both the hormonal side of things and the sperm side of things. I mean, it's very easy to tell you on a blood test, it's very obvious which man is taking testosterone and which ones aren't. And unfortunately, even when you stop it, some men never recover.
Oh,
And even if they do stop it, it can take, 6 months, 12 months. And over that time period, some of those men are profoundly what we call hypogonadal. That means having low testosterone, and they feel terrible. Testosterone isn't a very, very addictive drug. It's potentially causing more problems than, other illicit drugs in Australia for different reasons. Very easily got, contacts at the gym. There are lots of clinics online that they give it in ways that perhaps aren't ideal. And so that's a real issue. So it's something that I think I actually was at I presented to the New South Wales Parliament last week. There was sort of an inquiry about infertility in New South Wales, and I was there with amongst other experts, and this was one of the issues we talked about. That this is something that I think government needs to regulate more tightly. How men are accessing steroids, which can be terrible for. So I actually call testosterone a poison for sperm. Now, don't get me wrong.
no, I understand. Yeah, yeah.
In the right environment, testosterone can actually be good for a person when it's medically done and under strict guidelines, when you've talked about fertility. And in fact, one of the guideline statements in the guidelines that I just published, it says, do not prescribe testosterone to men who may be seeking fertility. It's just very, very clear. And that's even if your testosterone is low. Even if it's low. There are other things you can do in sperm-friendly ways to try and improve that, but actually taking testosterone, through injections or creams or pills, whatever it is, yeah, it's a poison, and that's really important. The other thing, which is becoming sort of more important in the last, 5 or 6 years, and something that I do talk and lecture on to other IVF specialists, is concept of something called a varicocele. Now, varicocele is varicose veins of the testicle. A lot of men have it. 15% of men have a varicocele. Now, most of the time, it doesn't cause a problem. If you just do an ultrasound and you can't feel the varicocele, that's called a subclinical varicocele. It doesn't really make an issue. That doesn't cause an issue. But the bigger ones, the ones you can feel, especially the ones you can even see through the skin, they can often cause an issue. And in fact, and this is a very important statistic, is that the most common cause of secondary infertility, so that's a man who was able to father a child naturally, and now he becomes infertile for whatever reason, the most common cause of that is a varicocele. So that's an important thing that we are coming now more and more to appreciate, and how to diagnose which ones are the more significant ones, which are the ones that need treatment. And so that is something that we, as fertility specialists, we do look out for. And because varicoceles are so important, I actually devoted 6 guideline statements, 6 recommendations out of 80 in the inaugural guidelines for Australia just to varicoceles, because they can affect not only fertility in terms of secondary fertility, but they can once you remove a varicocele, it can even improve IVF outcomes. They can be associated with recurrent miscarriage. And so, yeah, it's becoming a very important part of the male fertility assessment.
So, Darren, what you said earlier, so if you have fathered one child, if you are looking to have another child, this can affect having another second child?
Correct. Definitely. Like I said, it's one of the most common causes of male infertility, because the problem can actually be progressive
Yeah.
with time, and it can cause, problems. But look, these are things that I said that are, you develop them often as a teenager, in adolescence, and there's only, a gradual decline. But also on the flip side, as you get older, perhaps with the same partner, her eggs might not be as strong as well. So, it takes two to tango. But yes, so if a couple comes to me and they've got some infertility and they have a varicocele, then it's something that I definitely talk about potentially treating.
Wow. So, you know how I told you about geriatric pregnancy? And so, do men have a biological clock?
Yes, they do. It's not quite as sort of distinct as in a female. It's more of a gradual decline. The differences in terms of, different ages looking at different studies, but some say as early as 40, 45, 50, things do start to decline in terms of sperm quality. We also know that there are some issues potentially for the offspring of older men, certain genetic issues, certain autism spectrum disorder. There are things that are increased in incidence. Now, I don't want anyone to think at the moment that I'm saying that if you're older, you're going to have, if you have a kid, they're going to have these problems. No. It means that the relative risk is increased, but the absolute risk, which means actually how much it's increased by, it is only a small amount. So the vast majority of men who have children at an older age will have healthy children and won't have these problems. But it is something that is important to at least discuss when men present in the older age bracket when they want to have a child. It is important to discuss that because there is some more DNA damage and the sperm's not quite as good.
Unless you're Al Pacino and you can father a child at 80.
Correct.
So, um, okay, so this is something that I've been wanting to ask. And so, what's the one misconception about male fertility you wish families would stop repeating at dinner tables?
Look, firstly, and I think I might have mentioned this beforehand, a man can look perfectly healthy. Yeah. You can't judge by just how they look. And in
Yeah.
fact, as I was mentioning, if they're super, buff and strong with massive muscles and they've used testosterone, that can actually, work against them to some degree. So that's important. The other thing is there is so much pain that goes on with infertility in a couple, so much pain, right? And, when there's family or friends saying, oh, when you're gonna have a kid or when you're gonna, they don't need any more reminders. They really, really don't need any more reminders. So it's a personal issue, and it should stay that way. And although people might be, well-meaning and helpful, there's a lot of pain, there's a lot of stress, a lot of anxiety in a couple when they have infertility. And so I don't think it should be discussed at all. Yeah, it shouldn't be a dinner table discussion. It really shouldn't be.
Okay. So, we talk multiculturalism all the time. So, in close-knit community, fertility struggles involve parents, in-laws, community expectations. We have our next door aunties and uncles who are constantly badgering us the minute a couple mostly in South Asian families get married and not having a child, decide not to have a child also. How can couples protect their relationship while navigating all these pressures?
So, Salah, I said, this is a personal issue. It's between the two of you, right? It's between the couple. The extended family, yes, they're loving, they're doting, they're caring, they want to help. But often it doesn't help and just can cause more stress, especially when, one side of the family or even both, can be putting pressure on what's going on. It's important, I think, that the couple, show a united front. They sort of come together and say, this is what we're going to do. This is how we're going to, project things, and it can be very challenging. But I think coming together as and showing, a shared strength together, making decisions together, doing what's best for them as a couple, not what's best for the parents, I think is critical. And I see this, quite frequently, actually. Some couples who have, moved here to Australia and their families overseas, they actually say, they actually, are very um, pleased that that's the situation. They don't have to deal with their parents all the time, talking to them all the time around the dinner table. They say that we've got their space to work through this difficult problem ourselves, rather than having that external pressure, external community pressure, external expectations, and that's important also for families to understand. And don't get me wrong, family support can be critical in this. It can be really important. Having someone to lean on, having that shoulder to cry on, that's important. But there shouldn't be judgment. There shouldn't be pressure. This is a couple's issue, and they should be together on it.
And sometimes it's not the parents, it's the extended family who put so much pressure on the parents that it's mind-boggling. Because in our culture, the minute you get married, it means, in 9 months you should have a child. Otherwise, you have failed. And I know things have changed. I mean, my daughter's generation has changed, but there are still people who move here and face this day in and day night. And the pressure is tremendous.
No, and I see it and I hear it, almost every day with couples, and it's not, and I understand coming from the Southeast Asian culture as well, but it's actually all cultures. It's natural for parents want their kids to have kids and they want to be grandparents, and that's natural, and it's all cultures that do that. And yes, I appreciate that some cultures may put more pressure than others, and I mean, couples often, understand that their parents are coming from a place of love, and they want their kids to move on with their lives and go to their next step in their sort of lifestyle and have their own children. But having that, just asking what's going on, it can cause a lot more pain.
Yeah,
And I think perhaps it's something that we can all learn from, no matter where we are, in whether we're kids, whether we're adult, whether we're parents, grandparents, is that most of these couples, when they do get married, they do want to have kids in their own time, and having that pressure, it just doesn't help.
it doesn't. Yeah. So, what advice do you have for women who want their husbands to get tested? Because this is it's walking on thin ice, They want the husbands to get tested, but fear conflict, denial, or family interference. Because, again, a man can do no wrong, a man can have no problems. It's always the women, and I hear it so often, so often.
So I think just knowing that the men should know that 30% of the time, if there's an infertility issue, it's going to be their issue. When I say their issue, not a blame thing, but there's going to be something that perhaps that they can help, and they are the only one that's standing in the way of that. But it should be framed, and hopefully I'm saying this throughout this podcast, is that this is a partnership. This is a couple's issue. So the way that sometimes is a good workaround is for the female partner to say, look, let's go and get tested together. Let's go and do this together. I'll go to my gynecologist, obstetrician, and you can go to your urologist and your male specialist, and let's go get some tests done as a partnership, and let's see where it all stands out. And because there is and I hear this all the time, just because a man is able to produce semen doesn't mean that there is sperm within that semen. And this statistic often shocks people. So when a man produces semen, only about 3%, maybe up to 5% has sperm. The rest of it is just, everything else to sort of support the sperm. So if you've got, a man who has zero sperm and a man who has normal sperm, you actually can't tell the difference just by semen being produced. And that's critical. But I hear this all the time. I was ejaculating and there was sperm, and I was ejaculating, there was semen, and I just presumed I was fertile, but no. And so having that test, having that semen test, doing some hormonal tests, it's just the first step to at least recognizing there's an issue, working on it, and it can often prevent, unnecessary delays, unnecessary tests for your partner, And if, like I said, if you approach this as a partnership, as a couples issue, it's much easier than saying, you or me, something like that. Correct.
So if you've been trying, say, for 6 months and you're not able, and the woman is not able to conceive, would you then suggest the man go and get tested?
So it comes down to age as well.
Yep,
Um, and, firstly, you've got to think, are there any other health issues going on
sure.
that you might be at risk? And if you think there are, then yes, getting tested earlier rather than later. Some people, when they are going into trying to start to have a kid, some people decide we're both going to get tested and see where we're at. Is there anything that we can do to help the process? Just like if you're going to engage in, a bigger a marathon or something, you get tested. You start training. Do I have to lose weight? Do I have to take any supplements? Some people actually prepare to conceive. If and women do that quite well. They see their obstetrician or their
Yep,
GP. They make sure they've got all their vaccines. They take the right supplements. They make sure everything do their tests, and the men just turn up on the day, so to speak. And often that's not the best way to do things. They should also be checked, or at least consider being checked. The other thing to appreciate when patients say, "Oh, we've been trying for 6 months," what does that mean?
yeah,
Does that mean that they've been actively trying to conceive? And by doing that, this is what I mean by actively trying to conceive. So the woman needs to understand when she's in her fertile window. Okay, that might only be 5 days a month.
yeah,
So often going to the chemist, buying one of those testing kits, or there are apps that women can use. So they need to know the period, or it's probably the best term. They need to know the time frame that they are fertile. Then the couple need to engage in regular intercourse around that fertile window. At least every second day is probably good enough. Trying to do it every day can be, quite a difficult thing to do. But every second day is manageable for most couples. The other thing is they need to do simple things like some couples use lubrication. Now, most lubrication you buy on the market is actually spermicidal, kills sperm. So you need to go and find or source from the internet, or you need to look for ones that are sperm friendly. There are a few on the market, but if you just go down to the local chemist, buy a lubricant, most likely that lubricant will be spermicidal. And that's important. So you need to just nut through these issues. If they say we haven't, we've been trying for 6 months, but sort of we haven't really been timing, or we've been using the wrong lubricant, then maybe they actually haven't given it a good shot. On the flip side, if they've been doing it for 6 months or certainly 12 months and they've been doing everything, by the book, they've been optimizing what they can do, yeah, definitely getting tested is the way to do things. Remember, this is just an information gathering
yeah.
part of the journey. This is all we're doing, getting information. How can we help things? How can we improve things? And that's all it is.
Um, have you seen moments where addressing male fertility actually brought couples together, despite all the pressures that everyone goes through, both men and women?
Absolutely, 100%. Look, everyone approaches this differently, but certainly there are times, and this can be in any stressful part of, sorry, in any relationship when there's a stress. Sometimes it can make or break a couple's relationship. But at least the patients that come to see me, yes, certainly they are often together on this. It's a struggle. They have a focus. They work together. Look, maybe I've got what's called a selection bias. I'm obviously seeing the couples that want to have a child together, despite knowing that they're infertile. Because when someone comes to see me, often the diagnosis has been made. There are there's an issue that's known about, and so they've come to me to get help. Not always the couple comes together, and then perhaps there are some underlying issues, but often they want to get help. Now, for the couples for which the relationship unfortunately has broken down, I might not ever see that couple. So I've got a bit of a selection bias, but certainly there are in my clinic, often when I see the patient, even at the start, middle, or the end of the journey, by the end of their journey, no matter what the outcome, often they're a stronger couple together because they've gone through a challenge and they've come out the other side stronger.
Thank you so much for joining me, Darren. This has been amazing. Thank you so, so much for today, and for everyone listening to this podcast. If this has helped you, please share. Thank you, Darren.
No, I really thank you for this bringing to light and shining a light on this incredibly important topic, and I really appreciate you for having me on today.
Thank you.